Greetings to Madam Bibiana. My name is Norsahiran ZAMANI. My group will present about the SDG 3, which is the good health and well-being. To start the presentation, I will briefly explain about the introduction. Sustainable development is a development that satisfies present needs while preserving capacity for future generations to satisfy their own needs, according to Brundtland 1987. Sustainable development asks for coordinated efforts to create a future that is inclusive, sustainable, and resilient for both people and the environment. Harmonizing three key factors, which are economic growth, social inclusion, and environmental protection, is essential for sustainable development. All of these factors are important for the welfare of people and societies and are interrelated. Sustainable development strategies aid in a country's ability to adjust its growth to the problems posed by climate change, thereby protecting vital natural resources for current and future generations. Goal 3 seeks to guarantee healthy lives and advance well-being for all people regardless of age. Human health and well-being depend on a clean environment. Every stage of life, starting from the beginning, is vital of one's health and well-being. This objective covers all key areas of public health concern, including access to quality, cheap medications and vaccinations for everyone, as well as reproductive, maternity, neonatal, child and adolescent health, infectious and non-communicable disease, universal health coverage. SDG 3 focuses on important targets that improve the general health of a nation's people in order to minimize needless suffering from preventable disease and early mortality. Priority areas are those with the largest disease burdens and underserved populations and regions. Goal 3 also asks for increased spending on health funding, risk management, and research and development. In order to achieve SDG 3, which calls for eradicating poverty and decreasing inequality, universal health care is essential. Thank you. I will pass with the next presenter.
Greeting to Madam Bibiana. My name is SYAHRINA and I will be present about program of good health and well-being. This long-term program has three main strategies for good health and well-being, each of which achieve significant goals and ensure health and well-being for all individuals at all pace of life. The first program is the Healthy Lifestyle Program. Obesity in children is significant public health issues in the 21st centuries, affecting low and middle income countries, particularly in urban areas. In 2010, over 42 million children under 5 were overweight, with North America, Europe, and the Western Pacific experienced the highest annual increases. The Healthy Lifestyle Program was created by the National Institute for Health and Care Research to prevent childhood obesity. The program focused on a rational approach to behavior modification, establishing partnerships with schools, children, and families to create supportive settings for healthy lifestyle choice. The delivery techniques employed are engaging, encouraging children to identify and adopt healthy living ideas, motivation them to take them home, and impact family change. The Healthy Lifestyle Program implications for future behavior change initiatives are discussed, emphasizing the importance of building connection at school, child and family levels, and fostering trustworthy, also supportive connections to promote child health and well-being. The second program is a Community Sehat Pembina Negara. The Community Sehat Pembina Negara program aims to introduce a risk factor implementation for a non-communicable disease in Malaysia by establishing community health volunteers with skills training. The prevalence of a non-communicable disease and a risk factor in Malaysia continue to rise, with 1/3 of Malaysians having high blood sugar and 1/5 having high blood pressure. These trained volunteers will serve as agents of change in their communities, introducing and facilitating healthy living practice. QUASPEN is the first nationwide program to implement such a strategy beginning in 2014 and proceeding in stage. The program aims to increase community participation in adopting and practicing healthy lifestyle to prevent and control NCD risk factor. The program is a large-scale implemented across Malaysia in partnership with the Ministry of Health. The success of COSPAN is attributed to strong leaderships and positive role models with the COSPAN community. The health screening scope demonstrated the highest level of compliance compared to another scopes. The positive participation of the program implemented suggests that the quality of the program component should be enhanced. Therefore, it is recommended that the COSPAN program be implemented on a larger scale. The last program is the program Maternal, Newborn and Child Health. The UNICEF program focuses on maternal, newborn and under 5 survival, health and development between age 0 until 5. It aims to prevent HIV infections, transmission, stillbirth and tetanus in newborns and mothers. The program ensures the integrity of maternity and perinatal care for women and infants, including emergency obstetric care and newborn specialty care. Implemented in the United States, it shifts the impasse from disease and interpretation-specific initiative to care for mothers and babies around delivery. The program improves civil registrations, vital statistics recording, and impairs the mother as a primary caregiver of the child. It also emphasizes access to vaccine, life-saving goods, supply chain, and healthy markets. The program targets pregnant and breastfeeding mothers, infants, and children aged 28 days to under 5 years. The program offers a high-impact, cost-effective, and comprehensive maternal and newborn intervention that save lives. Health providers and support program enhance the quality of facility-based and community-based care for pregnant women and infants by providing guidance and training. That is all from me, thank you, and I will pass to the next presenter.
Hello, my name is Norsahiran. I will be presenting about the benefit of the first program. Investing in basic healthcare can improve health for all social groups while also reducing health disparities within. This program demonstrates that excellent health has a positive impact on development and that reductions in general morbidity and mortality can aid in driving productivity and economic growth. The fact that childhood obesity is more likely to continue into adulthood as a child gets older is one of the main reasons why obesity prevention in children is so important. The benefit of the Healthy Lifestyle Program HELP is it can prevent from diseases such as risk of heart disease and type 2 diabetes. Diabetes can be prevented from occurring by doing medications that help blood sugar level at normal rate. Therefore, the researchers discover around 25% reduction in the incidence of type 2 diabetes for every 66 gram increase in daily fruit and vegetable intake. Next is the children also can boost the immunization just by doing a healthy lifestyle. It is because from any food they digest can provide many good vitamins and help the digestive system function well. The immune system can protect against bacteria that cause sickness. As the last point, practicing a healthy lifestyle can strengthen their bones that will become their advantages in the future. As people get older, they will easily get infected by disease called osteoporosis. Therefore, these diseases can be avoided if healthy lifestyle is being practiced from young age by eating balanced diet that contain calcium and vitamins. And the last one is healthy lifestyle is important because it can lengthen lifespan. Healthy things can make our body stronger and more immune from communicable diseases or such thing. And that's all from my part. Thank you.
In all nations around the world, initiatives to enhance maternal and child health have been in place for a very long time. The benefit of this program is the organization be able to preventing maternal deaths for the newborn and child health. Making programs for newborn, maternal and child health is a regionally strategic strategy taken by the WHO Malaysia with the ultimate goal of speeding measures to improve the health and care of mothers and newborns. The program approach offers the chance to raise awareness of the unfinished business in maternal and perinatal health, and it is also creates a way to coordinate efforts to speed up the improvements that are required. The program approach acknowledges that a multi-sectoral approach is necessary for the implementation of the plan and its result due to the numerous factors impacting maternal and perinatal health conditions. Preventing diseases and early deaths in pregnant women and children benefits the entire population, as the children born and raised by healthy mothers are more likely to be as well, and children who are healthy grow up to be healthier adults. As a result, enhancing maternal health and implementing this program is essential to preserving the lives of the hundreds of thousands of women who perish each year as a result of complications during pregnancy and childbirth. For the third program, which is the Healthy Communities Program, this program supports not only the physical and emotional health of people living there, but it also works to enhance other factors that affect health, including as education, social support, and the built environment. The growth of these programs has produced several benefits. One of the benefits is the organization's ability to achieve its ultimate goal of becoming a truly global force, since it provides assistance to everyone in need. One of the programs established community health volunteers who have received the training they need. In the form of programs and community development, the organization has helped the populace. This serves to keep them inspired and more motivated. These strategies are crucial for ongoing community engagement, lobbying efforts, and the development of health programs for the volunteers. People who are in good health are better able to support the social, political, and also economic growth of their communities and nations. As an example, this organization provided support for the COSPEN campaign, also known as the Community Sihat Pembina Negara campaign, which helps train health volunteers. Other than that, this program also entails increasing community knowledge by altering risk perception, offering basic tools, technologies, and lifestyle options, as well as aiding the process by which the community members select suitable solutions. The emphasis of this plan was on a community or population-based strategy, along with a risk reduction intervention that was tailored to the person. The COSPEN program of community-based action comprises not only give the community by bringing about behavioral changes, but also strengthening the community by encouraging them to participate as change agents and motivating them to use their own resources for action. In general, COSPEN program giving so many benefits and was warmly received by community members, volunteers, and implementers, and the organization also will get more recognition around the world and be better able to assist developing countries.
Assalamualaikum and hi. My name is NURUL and BINTI AZMAN, and I will presenting my part, which is the suggestion to improve the program. For the first suggestion for improvement in this program is that school and parents play an important role, because teenagers need to get guidance from parents or teachers at school, because the right way to eat and not be easily influenced by advertisement promoted in the media. A balanced diet can be referred to the food pyramid, where the amount of nutrient contained in a meal is important in determining whether it's sufficient or excessive. Obesity among teenagers is to ensure that they practice a balanced diet like children in Japan. The Japanese school lunch program ensures that children get a balanced diet. In addition, the school can hold sport activities. All students must exercise at least 3 times a week for a minimum of 20 minutes. Not only that, they can also be actively involved in activities held at school, such as participating in football, hockey, and netball. In addition, parents need to provide moral support. Children will approach daily duties with more enthusiasm if they receive praises from superiors, just as adults do. At the start of each exercise session, and so on, offer the children words of encouragement to keep them motivated. The same is true of compliments and small gifts. This is done in order to make a habit that is simple to follow over time and eliminate the need for future instruction. As a result, making an effort to constantly encourage youngsters can be considered one of the key approaches to deal with children, because it aids in maintaining focus on the desired outcome. Next is Program Maternal Newborn and Children Health. The Maternal Health Quality Improvement Act was just approved by federal lawmakers as a part of the Omnibus Budget Bill for 2022. Through the Alliance for Innovation on Maternal Health, a collaboration between the U.S. Resources and Health Service Administration and SCOG, it will support educational initiatives to eradicate discrimination in the medical field, increase access to obstetric care in rural areas, and promote the use of best practices that are supported by evidence to promote mother and child health. Numerous communities and organizations decided to help dedicated to health are taking action. According to the American Public Health Association, investment in prevention, health care, and education lasts a lifetime. When it comes to maternal health, increasing support for breastfeeding, the project Reducing Breastfeeding Disparities through Continuity of Care has been developed by the National Association of County and City Health as official NACCHO, according to Harumi Rizwili, MS, CNS, LVNCHES, IBCLC, lead program analyst at NACCHO, with input from more than 100 maternal child professionals. NACCHO developed the continuity of care in breastfeeding support, a blueprint for communities designed to support local-level organizations to strengthen the community lactation landscape to ensure that families are supported through their infant and toddler feeding journey, also known as the first 1,000 days. Over 750 people have downloaded these resources to use in their communities. According to Rizwili, right now, 10 founded communities are implementing blueprint recommendations to increase breastfeeding rates and improve community health. Next is Program Community Sehat Pembina Negara. Establish a specialized health services commission and concentrate on developing an all-encompassing, seamless, equitable service delivery system that combines public and private services, a staffing system, a dynamic and sustainable health financing system, a national health budget, as well as a more reasonable ratio and distribution of health professionals. A hybrid health system, mixed and private, should also be developed in the near future, especially in places with a high population, few public facilities, and remote access. As a result, we may build larger facilities to house more specialists and provide better service overall. Prioritizing programs and initiatives for health prevention, and promotion that work to increase people's ability to manage their own health and well-being, self-care, community-based care. Particularly in the face of the epidemic of non-communicable disease, NCDs, and an aging population, it is believed that there is an urgent need for the development of specialized health personnel who are independent of health clinic staff and who can carry out community-based self-care and prevention programs. That's all for me. Next, I will pass for the next presenter. Thank you.
My name is ASMIDA binti SAMSUDDIN. Moving on into my part, which is conclusion. The Healthy Lifestyle Program, Maternal, Newborn and Child Health Program, and Healthy Communities Building the Nation Program provide a highly positive impact on all communities regardless of age or youth. This is because a program like this may raise awareness in all communities regarding the positive effect of living a healthy lifestyle. Furthermore, by developing such a program, the community can be helped and supported in order to avoid illness and health concern. Therefore, programs like this should be prioritized since the community needs to be aware of health issues and take proper care of each other's health. Moreover, with programs like this, the community's health concern can be controlled and reduced. Additionally, urban communities must be exposed to healthy lifestyle by implementing health programs such as visits, seminars, and exhibitions, as well as creating any health campaign. With that, they also do not miss out on knowing how to live a healthy. Not only that, it will raise community awareness about the danger of the disease. For example, the problem of obesity that affects children at a young age, so that this healthy program should be implemented in order to produce a healthy generation in the future. That's all for me. Thank you.